Hello, you guys. Welcome back to Do I Look Sick? I am Mia, of course, with Sickle Cell Awareness 365, and I'm so happy to have not only my guest co-host, Dr. Rashawn Hodge, but my always co-host, Jennifer.
Hey, you guys, I've missed you so much. We have to talk about that story later, but I've missed being here.
Yes, definitely make sure y'all tune in to the next show because we got some good stuff for y'all. But today we have the wonderful Dr. Rashawn Hodge, who is a chronic pain doctor, who is a wonderful sickle cell advocate and a medical marijuana advocate. So I know a lot of people have been kind of asking me questions to ask him questions or trying to get in touch with him via my Facebook, but he is here and you guys can call in. I'm going to give you the number now. So you guys can call in and ask him any questions you want. 470-251-4647. That's 470-251-4647. So, Dr. Hodge.
Mia, what's up? So happy to be here.
I'm so glad.
Yeah, happy to any gems you need for the sickle cell folks, my soldiers, caregivers. Any questions you have, I hope you love our style of teaching. Hope you learn a lot and mind, body, and soul.
Absolutely.
Cannabis. Yeah.
Absolutely. I'm so glad we were actually able to come to the studio this time. Last year you came on and dropped so much knowledge. I continue to watch that video because I get different things from it. And it was just amazing. I follow you on Instagram, so I'm always checking out what you're doing and how you're helping the community, and I absolutely love it.
Appreciate it. Been in Atlanta 26 years. I fell in love with it when I first came in here, coming from New Jersey. Just the black wealth, the people, the southern hospitality, the professionalism. I was sold, so I'm staying obedient to Atlanta, and my services is for the people here.
We
Absolutely.
thank you. This is my home, so
Yeah.
we thank you. We appreciate you.
Yeah.
What do you have new going on since we spoke with you last?
Man, I got a lot of stuff. Well, I'm in school. I'm getting my master's at the University of Maryland. They have a master's of therapeutic cannabis program. It's a 2-year program. I'm the class of 2022, and I'm forever curious about cannabis now. So what
Nice.
I thought I knew about cannabis, I didn't know much.
Okay.
And I implore not just the master's program, but there's a lot of colleges and universities that are having some type of cannabis in their curriculums. Very important for the $53 billion industry in a year and a half. So I've been busy with that. And we're all waiting, There's about 15,000 Georgians on the registry, and I'm a patient as well. We're waiting for the growers to be announced here in Georgia any day now.
Okay.
It's any day now. 2 large grow, 4 small. And then University of Georgia in Fort Valley, again, will be growing cannabis. And then a week or two, the retail applications will become available in our state. That'll be on the website, Department of Public Health, georgia.gov. And there should be 30 retail opportunities here in Georgia for the first year. And I want people to, be excited about that, get their cards, and also if you're interested in the business, go for it.
Nice.
So there'll be bud tender jobs, security jobs, chemist jobs, all in the next week or two that, everyone should take advantage of.
That's awesome to hear.
Yeah.
That was actually one of my questions, like what has changed as far as cultivating it here, purchasing. What's changed since last year, like she said?
Since last year, they just tweaked the bill to allow pharmacies maybe to dispense cannabis oil. As of now, we're still cannabis oil only. No vaping, no patches, no topicals, no suppositories, no MDIs, no transnasal, just oil only. There's been total 18 jurisdictions now that have been decrimmed.
Okay.
We added West Point, Georgia. That was like the 17th. So that's good. I mean, we still got to push for statewide decriminalization, but you guys know Clarkson was the first city in Georgia, 2015. Atlanta was 2016, and then Augusta, Gwinnett, Decatur, DeKalb, so on and so forth. We still have the 17 applicable diseases. 2019, we added autism
Nice.
to the disease.
Oh, okay.
Yeah, that's a list.
Awesome.
And if you guys don't know, sickle cell was the original eight.
Yeah.
The original 8 applicable conditions or diseases for cannabis here since 2015. And I got some news that hopefully I can announce in a week or two, you know?
Nice.
Yeah,
Nice.
been working
So
on.
are you finding that like hematologists and other doctors are becoming more open to using medical marijuana?
Um, I see more doctors signing up for the recommendations, and you know, when I was doing the recommendations for the state, I was really busy. You know, first it was a lot of word of mouth. You know, it was a lot of knocking on doors. You know, cannabis was new here to Georgia. Cannabis was very new to caregivers. We only had 8 diseases, but a year or two, then you saw more. You know, more hematologists, more oncologists, a lot of psychiatrists. Even the VA was like flooding me with patients.
Nice.
So
Okay.
that was great to experience. And you know that some of these doctors like, look, you know, cannabis may help you. You know, these conventional therapies have failed you. So you know now we're kind of. I think once federal legalization is announced, with Schumer. And we get cannabis off the controlled substance list announced, even if it does take a year, then all the research, all the docs are going to get in. And let me remind you, the government's always, they've been in cannabis since 97, 98. Last year we had Epidiolex, so now we have 5 federal FDA cannabis approved drugs.
Okay.
So
Is Epidiolex?
Epidiolex.
Oh,
That's pure
Epidiolex.
CBD in
Okay.
a liquid form. So that was approved by the FDA last year.
Okay.
And Epidiolex is for it was based off it's based off healing kids with Dravet syndrome or severe epilepsy.
Okay.
But there's a off-label use for Epidiolex since it's CBD that doctors can prescribe that to their patients for chronic pain, for an immune booster. It's off-label use for if the doctor understands CBD, you can actually get a prescription for pure CBD, and that's something your insurance may or may not pay for. But at least But there's 5 cannabis drugs on the market now. So doctors have been prescribing these since they've been on the market. It's just too little of us and not enough education out there.
Definitely. And it's hard to get some of the doctors to kind of be on board. I honestly think a lot of them are just not with the whole holistic or wellness type treatment. Like Jennifer mentioned, they're more reactive and kind of want to fix it on the back end. But
Yeah.
Let's cut it before it gets here.
That's
So,
a good point, man. A lot of the, for my caregivers and for my constituents, anyone in the healthcare field, medicine must be comprehensive. You must approach the patient, mind, body, and soul. You got to ascertain their support, ascertain any comorbidities, because some people, everyone's different. So, we were taught in medical school that, there's a gold standard treatment. And if that doesn't work, go to step 2, step 3. And then we're told that this gold standard of treatment, this one pill fits all. And we all know that's terribly wrong. Healthcare disparities, and it just caused a lack of mistrust with the healthcare system. So as we build this new cannabis, as the cannabis industry starts to build, especially the therapeutic industry, I definitely want to be in to do it ethically,
Yeah.
I understand that everyone has their own ECS, endocannabinoid system. So what works for me, what I like to inhale, vape, edibles. You know, I got to be careful when I say, hey, Mia, this helps me for my chronic pain. Because she has her different ECS.
Right.
So you can explain the cannabinoids, you explain the terpenes, explain the flavonoids, and it's up to her response, you know, and doctors have to understand that when we moving forward, we got to be ethical about it and understand that everyone is different.
Right.
And we have a chance to do it, you know.
So let's get to the science. I like to know the science behind
Cool.
some of the stuff. So how exactly is cannabis helping, like, in the brain or in the body, versus how is it able to treat all of us, even though we're different? And how does it work differently from the actual opioids or antidepressants? Does that make sense?
Yeah, great question.
Okay.
So the question is like, how does cannabis work in our body? Well, we have to understand
Yeah.
the biology and the chemistry, you know, and what you're asking is about pharmacokinetics, you know, what does the body do to cannabis? We all know that cannabis is going to relax you, the pharmacology, but what's important to understand is that we have an endogenous, means within,
Okay.
right? Simple. So we have an endocannabinoid system, just like the cardiovascular system, just like your gastrointestinal system. Now, the ECS, just to make it brief, that was discovered in the 1980s, fairly new. We just found out about CBD and THC in the 1960s. So we're on the cusp of just barely understanding this plant. So we call it endogenous cannabis. That means, do we have cannabinoids inside us?
Right.
Yes, we
Right,
do.
right.
We have a natural cannabinoid, and that's anandamide. So anandamide is part of our bliss molecule, and that helps with reward system and dopamine. Like, your body will release anandamide on a hot day to say, hey, you should drink some water. And when I drink water, I get a burst of dopamine. Like, yeah, that's my reward. Like, yo, that your body. If this stressed me out or gave me cortisol, I wouldn't want to touch the water.
Yeah.
You see what I'm saying?
Yeah.
So that's an endogenous drug. So what cannabis does, it copies what's in our body already, which is the anandamide. So we have THC and CBD. THC is the two cannabinoids that we know most about. But you heard of CBN by now?
CBN?
CBN.
I haven't.
It
I have.
helps with, you have?
Not.
Now you heard of CBG, THCV. There's 60 more cannabinoids that we're discovering. We know the 5 main terpenes to give it the smell. But going back to the 2 we know, CBD and THC. Now THC is psychoactive, so that's what we all know of. That gives you the high. Now when you inhale it, right? That's the most common way to consume cannabis. When you inhale it, which is a great that's a great delivery system of medication. You know, inhalers are used for asthma, COPD, bronchitis. We use inhalers all the time. So in Louisiana, you know, they have medical inhalers that look like asthma pumps. That's on the list, you know, eligible. If you have sickle cell, you can go to the dispensary and get an inhaler because it gets into your plasma within 1 to 9 minutes.
Wow.
Yeah, it's very quick. Everyone, if you smoke, that's why people prefer, because you can titrate it, pull to effect. But going back to the what a THC does. So once you light the cannabis up, right? Because you have to light it, and that will decarboxylate it and turn that THC into that delta 9 that everyone loves to talk about, right?
Okay.
Delta 9 is going to, you know, from your lungs, get across your blood-brain barrier pretty easily and stick to a receptor called CB1.
Okay.
Now, CB1, those receptors are densely populated in your brain, spinal cord, and a little bit in your periphery. And then I also talked about Epidiolex, right? That drug that I can prescribe you guys, right? Now that's CBD. Now that's non-psychoactive. Now there are receptors in your brain, but mostly CBD is in your immune system, densely packed in your periphery. So cannabis works by once your CB1 and CB2 receptors are activated, that helps with homeostasis with your stress, with your neurological system, helps with homeostasis with your reproductive system, with your gastrointestinal system. That's why it's so beneficial with people with Crohn's, ulcer colitis, leaky gut. It's great for your skin, which is the largest organ in our body. I'm talking CBD beauty. I'm talking patches. It's non-comedogenic. It's great for acne. It's because acne is an inflammation problem, and cannabis is anti-inflammatory. So that's how it helps regulate all the rest of your systems. And we always talk about do cardio, right?
Yeah.
10 years from now, we're gonna be like, yo, you need to do some cardio, you need to do some endo, and short for endocannabinoid system. You see what I'm saying?
Yeah.
Yeah. So
I think we got a phone call. Let's see.
I'll go on and on about the science, but pretty much that's what we have at ECS.
Press speaker.
I did. Hello.
Okay.
Hello.
You've reached Mia with Sickle Cell Awareness 365, and we have Dr. Hodge. You have a question? Hello?
What, y'all hear me?
Yeah, we hear you. You on live.
Okay. What's up? I'm Burke Black.
Hello, Burke Blackman. How can we
What up,
help you?
What's up, LaShawn? How you doing, man?
I'm doing good, King. What the question?
The questions are, man, they're coming out, they've already came out with the Delta 13.
I don't know much about Delta 13. There's not much research that's
No, it's on CBD shops that I got. And, they have Delta 8, of course.
right.
Delta 10, the throwaways.
Yes.
Vape. And but yeah, they came out with Delta 13, man.
Yeah.
I'm trying to make a what is it? An ISO labeling system for the state of Georgia.
That's tight, bro. That's tight.
Nice.
Love the innovation and research.
And I got people on the CBD boards and all that stuff. So I'm a 39. I'm a young buck. I'm still 39. You know what I mean? But I've been smoking weed ever since I was 12.
Damn. Why are you self-medicating for a reason, bro? Or is it recreational?
Now because they tried to give me 109. This is in 2017. And let me make a quick story on this. I was at work. Well, I'm fucked up or nothing, you know what I mean? Because when I work, I work.
I get it.
You know what I'm saying?
Yep.
And I was a wildlife nuisance professional who was certified through the Department of Natural Resources and the Department of Agriculture. Okay? So I was doing my damn thing, right?
Do the damn thing.
And I went and I was training the guy because I was a manager. I
Right.
was training the gentleman.
Right.
And I said,
You gotta fast forward it though, bro, because the story, we only got like a couple more minutes on the mic. Tell me.
All right, that's a bit. That's
Yeah.
a bit. I got you.
Uh-huh.
But anyway, I grabbed my 40-foot ladder route to remove a bird's nest in a soffit. Ain't no thing, right?
Right. I thought you was on 100-something pills though. You fell?
Say what?
What happened? I thought you was on 100-something pills. What happened with the bird's nest
Yeah,
though?
all right. Let me get to that.
Yeah.
But anyway, I fell on concrete, cracked my head open like a watermelon.
Damn. Damn.
Yeah, and that's 40 feet. So, okay. And that's the short story of that.
Got it.
Yeah, they tried to give me 190 Percocet 10s for a month.
Yeah, I'm glad you found cannabis, bro. I'm glad and replaced it all with cannabis. How are you?
I know that's right.
How are you?
Man,
Thank you so much.
Thank you for calling. We appreciate your call.
Yeah.
Have a
Appreciate the
good
stamp, family.
Thank you.
And on top of that, I hate to run y'all long, but they gave me on top of that 2 milligrams bars, Xanaxes.
Damn.
That's
120
awful.
a week.
Well, I'm
That's
so glad
obvious.
you're doing it naturally, baby.
Yeah, I'm glad to hear you're
Yeah.
doing a lot better. Thank you so much for sharing your story.
We appreciate the call.
So thank you, Burke Blackman, for your phone call and your
That was dope.
information.
Glad
That
you're feeling better, boss.
Yeah, that's such a transformation.
Yeah.
So yeah, we have all similar stories like that. Like you mentioned how you hurt your neck playing basketball,
Yeah.
and just life experiences just gets us to the point of using cannabis a lot. So has there been any? I'm gonna switch a little bit. Has there been any
Anything you
data
need.
about the relationship between cannabis and COVID-19?
Yeah.
Okay. Tell us about
Absolutely.
it.
There's been some biased articles and biased research by doctors like me that want to see cannabis really improving COVID. But there's a cannabinoid that I want everyone to pay attention to. CBD is a great immune booster, which we know, but also CBG.
Okay.
So CBG, those studies with CBG and CBD will be used for the next superbug. So now everyone's worried about these superbugs, right?
Okay.
CBG kills bacteria like antibiotics.
Real.
Yeah, I know, it's wild. CBD, right? Over the CBD, right? Kills bacteria. It's bacteriostatic. It's amazing.
It is.
Yeah.
And it's amazing because I'm on like a bunch of antibiotics right now, and if I could do something other than that, that would be lovely because it's taking up a lot of my day.
Yeah.
Well, yeah, consult with your physician before you're on before you stop taking your antibiotics. But you know, there's very, very helpful because what antibiotics do, they're going to kill the bacteria they're supposed to kill or help fight a virus, right? Because antibiotics don't help with a virus, and this is a virus.
Okay.
But they also kill the good bacteria in your gut. And so, you know, that's why, you know, when I would prescribe a Z-Pack, I say, hey, are you very sensitive to Z-Packs? Do I need to give you a diflucan?
Okay.
The reason why docs will give you a diflucan or something for yeast infections because that bacteria, which is, you know, you got an infection in your lungs, is going to kill that lung infection, but it's also going to destroy some of your natural flora, natural organisms from your mouth to your butt. And also it's going to destroy some of those microorganisms in your vagina and change the pH. And now you're getting bacterial vaginosis. Now you're getting yeast infections. And guess what? I got to get you another antibiotic for that too.
I hate
You dig
that.
what I'm saying?
Yeah.
And then your liver has this task of eliminating. Kidneys have a task of eliminating. And
We have another phone call. Let's see. Thanks for calling. Do I look sick? This is Mia. Who am I speaking with?
Manaya.
Hello, Manaya. I have Dr. Hodge with me. You have questions for us?
what's up, Manaya?
You're on the air, Manaya.
We can barely hear you.
What's going on with this? Can y'all hear me now?
Yeah, that's good.
Okay, I was wondering how long did it take for him to become a doctor?
Oh, shit. 4 years of college, 5 years of med school because I almost got kicked out, almost failed out, and 3 years of residency. So that's 5, 3, and 4.
Nice. Are you interested in becoming a doctor?
Yeah, it's about 11 years, I believe.
No, I'm a phlebotomist. Well, I don't know how to say the word.
Phlebotomist.
Phlebotomist.
That's awesome. We need you because doctors
do.
can't draw blood.
We do.
Yeah, we don't know how to draw blood. Y'all do.
Yeah.
Yeah,
We
and
need
you always
the-
say, doctor, do it. And you be like, shit, you guys do it. You guys did all the training.
And we as sickle cell patients definitely need
Yeah.
you on the team to know how to find those veins and
Yes.
everything. So keep up the good work. Thank you so much
Shout
for
out to
calling,
all the
Manaya.
phlebotomists that are very patient and empathetic, you know.
Thank
Yeah,
you.
find that vein. First time.
Listen, that's so serious.
Find the vein first time. There's no more people. There's no one more scared of needles than me.
No way.
Shit,
Wait,
for
how
real.
many tattoos do you have, sir?
I have over almost 150 hours, but the needle doesn't go into my veins.
So you probably act like a big baby.
Men are big babies, period. But yeah, I can almost feel like I'm gonna faint.
No.
I swear to you.
And I have to look I have to look at what they're doing. I can't
No.
look away.
Definitely.
I have to
Looking makes it worse.
It doesn't. If I don't look, it makes it worse.
You're tripping.
This phone is off
Shout
the
out
chain
to people
today.
that don't look when they get a shot.
Shout out to the people that do.
Yeah.
We gotta know what they're doing.
No.
All right, we have another phone call.
Okay.
This is Do I Look Sick? You are speaking with Mia and Dr. Hodge. What's your question?
I wanted to ask Doctor if he is accepting new patients and if, as far as if he hasn't, who would he refer? Because who would he refer? Someone is growing and everything else. What does that look like now for the Atlanta area?
That's a great question.
Yeah, I unfortunately I had to take a pause because there's now a conflict of the state in October for doing the cannabis recommendations. I would have loved to help you. There's a doctor that I posted, and I'll shoot it to Mia, and Mia will. Do you have Mia's DM or IG?
Are you on
No.
Are you on Instagram or Facebook?
Yeah.
You can follow us on Sickle Cell Awareness 365 or SCA 365 and shoot me your question, and I'll make sure that you get it.
Yeah, I'll shoot you the number. The doctor's just getting his telemedicine situation straight, so he should be ready to start seeing patients.
And what's your name so I know who to look for?
Tara?
Tara?
Yes.
Okay.
Tara, yes.
All right.
And let me just write that down. So, and Dr. Hodge, you're not accepting. You said you're not accepting any new.
No, not at this point, not at this moment. I hope to start doing it again, but it's now a conflict, you know.
Okay, and then let me just get that IG. And Dr. Hodge, I just love your videos with your dad and your mom.
Oh, appreciate it, man.
so
Thank you
sweet.
for the support. And my dad reads all the comments, so thank you.
Okay.
You just make his day and his mom.
Give me that IG, please.
Our IG is SCA 365. Sickle Cell Awareness 365. Thank you so much for calling.
You're welcome. Thank you, and have a wonderful day. Keep
You
doing
too.
what you're doing, Dr. Hodge. Thank you.
Thank
Most
you.
welcome.
You got a hotline today, Dr.
Man,
Hodge.
we're here to help. I mean, I love that the village is stronger and we're all getting educated, and you know, we're gonna look at cannabis as this is probably the first choice for me.
Yeah.
If that fails me, then we may go to conventional, but
Yeah.
cannabis first, exercise, sleep, just comprehensive, you know?
Right, absolutely.
You know?
So she did ask a good question. That was one of my questions about you taking new patients. But, and I know you're not, but I noticed that you have pre-rolls and capsules.
Yeah.
Tell us about that.
Man, a lot of R&D, and I just wanted to make sure it was an ethical product that I could stand on. So yeah, I got a pre-roll CBD, and it's got some CBG from CBG flower, 0 THC in there. So it's good for all my folk, all my patients, all my caregivers, and even people that have a federal job that are not allowed to use CBD because of the risk of testing positive. I have a daytime focus with some terpenes that I believe really help, lock in. And then I have a nighttime CBD capsule that's got some linalool and some pinene in it, a little bit of myrcene, and that's really good for sleep onset, sleep duration, of course, your chronic pain, but definitely will kind of chill you out. The gummies are great. I like them, you know, they work better for sleep
like the
than me.
gummies.
Yeah, the gummies got 2 different flavors on that. Also have topical rubs. Topicals are great. If you haven't tried, for systemic, of course, it bypasses the liver. So for people that don't like the effects of edibles, you can always use a topical.
And where can we order it from, or where can we get it
Yeah,
from? Can we go buy it?
holistichempgeorgia.com, or they're exclusively at a shop off the Beltline called Holistic Hemp Georgia. So check it online, holistichempgeorgia.com. Grab what you need. I have multiple delivery methods: inhalation, of course, oral, and transdermal.
I had a question, Dr. Hodge. I kind of want to go back to something you said before the first caller. You were saying that in Louisiana they have like inhalers
Yeah.
that can deliver the CBD. Is that something that's recommended for people who like have asthma or pulmonary hypertension, or is that something that's strictly for like people who deal with like chronic pain or like trouble sleeping? Like, who benefits best from that product?
Great question. All conditions benefit from inhalation. So, cannabis is the number one abused drug around the world, but it's the oldest medication that doctors used to prescribe in all civilizations. Asthma, specifically asthma, COPD, that was one of the first conditions doctors used to give patients their cannabis, because asthma is a bronchoconstriction problem, and the second part of it's inflammation. You see what I'm saying?
Yeah.
Lungs tight. Now, what does cannabis do? So this inhaler of THC and CBD is going to help with bronchodilation and it's anti-inflammatory. So it's great for asthma. It's great for COPD. So that inhaler, what you're talking about, is a metered dose inhaler. It's not just like, hey, smoke. I'm talking about, hey, you hit this pump, you're going to get the same exact dose every time you hit that pump. So it's true medicine. I can say hit that pump every 4 to 6 hours, just like albuterol inhaler,
So what would you say, would that be like the same thing for those who deal with pulmonary hypertension? A lot of people with sickle cell disease, well, I won't say a lot, but some people with sickle cell disease have pulmonary hypertension.
Pulmonary hypertension is they do. It's different than asthma. It's different than your typical bronchitis or cause emphysema. It's totally different. I would safely say, hey, we got to do longer term studies, bigger, not just 5 people. Let's get like 30 people enrolled, men, women, and do a double blind and do some more research and see how we can effectively reduce or effectively treat pulmonary hypertension. But as far as asthma and other forms of COPD, inhalation is great. Now, the reason why I say use an inhaler, because some people don't want to combust. So that vape pen you guys seeing, you don't see a lighter, but there's a battery. So there's other ways, that non-combustible ways you can inhale. So again, there's a nebulizer. You've seen the kids with nebulizers, those face masks, So there's a nebulizer you can do to give people cannabis. There's a meter dose inhaler, like the albuterol, like that pump. But then you can also, there's combustible ways, like smoking, rigs, but you got to use some fire. You dig? Or you got to use a battery.
So I want to bring up something you mentioned earlier, and we started to talk about before the show, about the mistrust in the community. And not, of course, the Black community as a whole, but definitely with us having sickle cells. First of all, having our own traumas with the hospital and the medical staff, then seeing our friends go into the hospital and not make it out. How do we deal with that? Because I'm currently struggling on finding a hospital home that I'm comfortable with. Like, at this point, I don't trust anybody, any hospital. COVID is out, so it's still like, I don't even want to go to the hospital because that's where the COVID is. So it's like, what do we do? Because I'm pretty much at home suffering.
It's horrible, and I don't believe life's all about how much you can endure. But for the sickle cell population, it's, that crisis can happen as early as 3 months of age, You guys know that, but a lot of people are ignorant of it. And as a physician, we only get like 2 days teaching about sickle cell. I'm talking about healthcare disparity started with education. So we're a big part of the problem,
Say that again?
Doctors are a big part of the problem. And until I hurt my neck and then, joining the board of sickle cell, I was very ignorant of sickle cell. And not just, of course I can understand, sickle cell can't carry the oxygen. And if you can't carry the oxygen, that tissue is going to necrose. It's going to die. They're going to lose a pancreas. They're going to have a heart attack. But I didn't understand the trauma. I didn't understand, I saw my first dead body, took that person as a physician, when I was in the ER, I didn't lose my grandparents until I was in my 20s, you dig? So, but you guys are losing family, friends,
And it's younger and
teens,
younger.
and that
Yeah, they're getting younger.
that will cause a disease in itself. So it's the trust is not just ignorant as doctors and a lack of empathy. It's trauma. You know, if you recognize someone that has a disease and they go to the hospital, don't come back, they transition and they're a teenager, you know, that's going to affect you. I don't care who you are, right? So you're going to think about that for about 6 months. And what you have is acute stress disorder. You got acute stress disorder. You got sickle cell pain, chronic pain. And once it lasts more than 6 months, by definition, you have PTSD. So it's not just, you want to say it's trust, but it's your fault saying, hey, I have trauma. I have now post-traumatic. I can think about getting a crisis. I start to get scared because I got to go to this hospital.
Yeah.
I got to get, I'm getting nervous and upset because I got to meet a new nurse. My favorite nurse is not there. Oh my God. You know, where's Sandy? Where's Sandy? You know what I'm talking about?
Yes.
Yeah.
Yes.
Yeah. And
Yes.
that's not like, and then you're just going to get admitted and we're going to hydrate you, give you the morphine, but we never address the trauma, the psychological trauma. We never help you accept a loss. So you guys are angry, very bitter, confused, scared, when we don't even help you process and help you grieve appropriately. You
So,
follow me?
I definitely do.
Yeah.
Do you think having a therapist come to the room? I know when we are admitted, especially me for the first day, I don't want to talk to nobody, do nothing. But after that, especially those who have to be in the hospital often, would that help to get some of that stuff out? Because I honestly have gotten to a point like people are going into the hospital and they're not making it home.
Yeah.
And like you
Mina,
mentioned,
I'm sorry to interrupt, but you're saying like would a therapist help? I don't want to think it would help, but I think that what has to happen in that is that it has to be a therapist who is familiar with what people with sickle cell go through or people with chronic disease go through, because a therapist who never sees a patient who deals with that may not be able to come at us in a way that is going to make us less mistrustful, make us put our guard down, because it's like you have no idea what you're talking about in this moment, and you're kind of like giving me blanket statements of how to process something you've never even heard of or dealt with before.
that makes sense.
Yeah. I think the message is going to be received better when you have someone that's close to the situation and someone that looks like you too.
And that's
Very,
even
very
harder.
important, and which is very hard, you know. Again, black physicians make up only 3% of the physicians out here. Black male physicians is only like 1.5 of all the physicians you see. So, and it's going to take a doc like me that's been practicing 20 years to truly get it, you know? It's like you don't learn how to really drive until you like snow, hurricanes, you know, black ice. Then you like, I can drive, you follow me? You know, I can a drink or two. I can drive, trust me. You dig what I'm saying? So, and then like if you guys just were just being told the honest truth, like, look, I'm gonna try to control this crisis, but you got these issues, and when I get you out this hospital, I'm gonna get you to this therapist. I'm gonna get you with this for your diet. Like, you know, I got this whole comprehensive plan, and I'm gonna say, hey, do you agree?
Yeah.
And I'm gonna empower you, you know, and you're gonna be like, shit, all right, let me get me out this damn pain. Let me so I can start taking oral medications again, because I can't wait to get off this thing, you know? And let me get something for my trauma. Let me try. You said I can go to a ketamine clinic. Okay, I'm gonna need some therapy, you know. Okay, other psychedelic medicines can help me, help reset my brain. Because once you have PTSD, those the way your brain communicates is damaged. Those highways are damaged, and actually it gets to a point where you know, the brain is like Mars, like a bunch of gyre, a bunch of hills and valleys. It starts to turn smooth like a bowling ball, almost to like dementia, like Alzheimer's brain. So,
Oh my gosh.
Yeah,
Yeah.
that was a lot right
stress
there. I loved it.
is the devil.
Yes, it is.
Stress is the devil. Stress causes cortisol, inflammation. Now, your cells are already sickled. You stress your body out more, that's going to cause the crisis. If you can't sleep, oh my gosh, that's when cortisol goes away and you feel more anatomized, you know, that homeostasis. And if you're not sleeping, stress 24/7, heart attacks, diabetes, stroke, hyperlipidemia, cholesterol going up, early menopause, early andropause.
Jeez.
You see what I'm saying?
Yeah.
It's not just an early death, like your life is like shitty, then you die.
That's awful.
Yeah.
That I hope people are taking note. I definitely took a mental
Yeah.
note, and I think for me, just the stress of having to go to the hospital is adding to the crisis I've been having. So
Yeah.
it's been a hot mess.
I'm so
but
sorry that you have to kind of navigate it by yourself. Healthcare dollars have to be reallocated, you know. Obviously, you know, and I think it's discrimination, and if it affected the majority, if this disease affected the majority, I believe there would have been a cure by now.
Absolutely.
So
Yeah, I'm both that too.
yeah, let's not bullshit one another. So all I'm saying is, like, you have the trauma, get in the hospital, get out of crisis, because you could have a stroke or heart attack just like that.
Yeah.
I mean, you know, your pancreas can stop. You'll be losing your spleen just like that. You don't know. It was fine, and then you woke up, terrible abdominal pain. We can't save you can't save that spleen.
Yeah.
You know, it's necrosis. The tissue's dead. We got to remove it. You follow me?
Yeah.
You're going to lose vision. You're going to have a stroke in your eye. You'll be blind. Yeah.
Yeah.
And that's a lot of a load to carry.
It is a lot, but it's a heavy burden to bear, not just for you, the person who has it, but for your caregivers, your family,
Yeah.
your friends,
Yeah.
and you know, you try to build a support system around you to help you
Yeah.
maintain. But I mean, they're not with you 24/7. They're not with you in the deep of the night when, you know, we're going into crisis, because it always happens at the most inconvenient time.
No.
And I hide a lot of my pain. I'm in the house with my mom, but I hide a lot of my pain from her and my niece. So they don't.
Then
They-
why do you
they
hide?
only
Why do
know-
you feel like you have to hide? Trying to be
Honestly,
strong?
that's one reason. I also know that when my mom sees me really hurting, it stresses her out.
Yeah.
When she sees it alone, it stresses her out, and it's like I don't want to stress her out.
Yeah.
Sometimes I just don't want to inconvenience her, so I hide it a lot, and then I turn around and blame her because she don't see it. But that's
Yeah.
The thing is, Mia.
That's a tug of war on me. I
It
don't like
is.
that because
I know.
I'm sorry. Go ahead, Jen.
No, it's okay. Go ahead.
No, I hate that you have an internal tug of war because, like, no one should be like, "Hey, rub some dirt on it." You know, you should be able to communicate
yeah.
to anyone, not just your closest. Hey, how I really am feeling,
Yeah.
and you shouldn't have to worry about the way they receive it, if they try to minimalize it, or if it stresses them out.
Yeah.
You did
You're
what I'm
right.
saying? Because you not talking about it is going to exacerbate
Yeah.
your pain, and then it's going to make your dark hole bigger. You're going to feel even more alone.
And I feel like if I
Yeah.
talk about it, it makes it more real. Like if I don't talk about it, maybe it's not really there.
Ah.
I know.
No,
I know
it's
that's not.
still there,
Yeah.
and your friends know it,
Yeah.
and you're doing yourself
Yeah.
a disservice
Yeah,
by not talking about it.
I agree.
And
I agree.
I feel more
Like I
comfortable
told
talking about it
you
with my friends.
before, when I had that nurse at NIH, and I was like, no, you know, I'm gonna thug it out. I'm good.
Yeah,
I hold this pain. You know what I'm saying? Like, I'm good. And she's like, no,
you know.
that's not how we're supposed to be living.
Yeah,
That's not how
Yeah.
you're supposed to be living.
yeah.
I'm saying this as your friend, as your business partner, as your sister,
I know.
because I love you.
We love you. Real shit.
Don't have me crying on this
Hey,
thing.
that's real gems. You're not supposed to do that. She's right. We
I
do
know.
love you, man. That's going to cause your body more stress. And believe it or not, man, you have to don't let the disease just blow up every bridge you people.
Yeah. Yeah.
And subconsciously you're gonna do that because you're gonna feel like I'm just not deserving to be around people. I just feel like a piece of shit all the time. I feel like shit, so it is what it is. You see what I'm saying?
Yeah.
And then there'll be bridges that people are trying to help you. And it's not just for sickle cell. It could be with a chronic problem. It could be with addiction. It could be with this super inflated ego, you know? And whatever it is, you know, people say, hey, I'm fucking with you. I'm trying to support you. And you're so scared to trust a motherfucker. And he's going to be like, shit, I tried.
Yeah.
Damn.
Yeah.
I tried. You know?
I get it.
Whose fault is it?
Mine. I got you.
Yeah.
And I'm just not gonna leave you alone.
What'd you say?
I said I'm not leaving you alone.
Yeah.
So you
I
gonna
know.
love
Yeah.
me.
I do. My sister tribe, including Jennifer, my friend Knette, and my friend Dakota, we hold each other accountable. We jump on each other like you know you need to be in the hospital.
Yeah.
We do each other the same way, and I feel comfortable talking to them because they know the struggle. They know what we go through. We might not have the exact same issues, but we all understand that sickle cell struggle. So let me get into this documentary before we have to head on out of here. So let's watch this clip of this documentary, and then we'll get into how you thought of this and what what has come of it.
Let's see.
Let's check it out, Jack.
You know, if you do something constantly, you become that, you know, so that's what I became.
I never took the Oxycontin. I never took it. I would just set it to the side and I would smoke cannabis.
Once I was introduced to Dr. Hodge, you know what I'm saying, he showed me a lot of stuff as far as like medicinal properties, man, that I could use for the situation that I got going on.
People think this is all about getting high, but that's just a negative stereotype, a negative stigma.
My name is Jeff. I'm from a group called Goody Mob, a group called Outcast. My father's on 16 medications. He's been in the hospital for the last 2 weeks. He was up moving around, cutting grass, and kicking it just 2 weeks ago.
No one understands the pain of my patients, but I do because I've been there.
I met Dr. Hodge at the Georgia State Capitol for Sickle Cell Advocacy Day. He was there talking about the benefits of medical marijuana.
The doctor said, we're going to put you on some new medicine. He was down in 48 hours. I had to take him to the hospital. I've been smoking weed since I've been 15, 14 years old. Weed. I just called this man. I said, man, my dad, man, bring me some medicine, home. He gave me 2-3 pills and gave me some gummies. He sat up in the bed and started eating. So all I'm saying is we're going to be real about it. Man, come on, man. How many people got to keep dying? How many people got to keep telling you that we're not changing?
Every doctor that I run into, this just, y'all so stereotypical, bro.
She was just laying there with the pipe or the tube still in her mouth, and she just looked like she was asleep. And I wanted to wake her up, but
if I didn't get the help I needed, I would have been dead.
I am not a drug dealer. I'm a healer. Committing a crime is never a good thing, but how could I sit back and watch my patients in pain?
He and his doctor are trying to convince state lawmakers to not only allow the growing of medical marijuana, but also to expand the list of conditions that qualify to include traumatic brain injuries and PTSD.
Nice. So, what made you come up with this idea and tell us about this documentary?
Oh, man, that was just something. I I guess the story had to be told somehow. In the beginning, we all got the cannabis because of something. If it wasn't catastrophic, you know, it was something so personal that you didn't want another person to feel that way ever again.
Yeah.
So the documentary was just a moment of transparency in Atlanta.
Yeah.
You know, pretty much people in Atlanta that I knew had you on there to represent sickle cell, Goody Mob, patients, even a supplier. You know, just to say, like, just to be transparent, and I believe that's the only way to really get to continue momentum in the cannabis industry. And for advocacy, we have to really just be honest while we're self-medicating, and use our voices and speak about cannabis in the most comprehensible form that you can articulate it in, and just keep on getting people on the registry, changing the narrative. This is first choice, not last option. Continue to break the stigma in church. Continue to get law enforcement on our side. Keep on fighting for decrim, equity, so on and so forth.
Nice. I love it, and I'm so glad you did something like this to let people know, like the kind of the real deal behind people consuming cannabis and how it has helped so many families. So, what's the progress on the documentary? Like, how soon can we see the whole thing?
Well, we're shopping it on some networks.
Okay.
And so what happens is, if they love it, we'll have a big budget and we'll shoot again. Okay. And it'll be bigger, you know, and we'll put it on some type of distribution.
Nice.
Yeah, so the world can see what we're doing here in Atlanta, because it's been great work.
Yeah.
You know, but we can't stop. Advocacy can't stop. We all stand on the shoulders of pioneers, ganjapreneurs, you know, people that have been in prison behind this plant. Yeah. People that are dead behind this plant. People that have been robbed, and, you know, so it's our duty to because we got the ball now, you know, and whatever they sacrifice, you know, it can't be in vain. Right. And whatever you've been through, you know, you don't want another young African American queen with sickle cell feeling alone and feeling bad to tell her own mom, hey, look, I'm going through a crisis because I don't want to stress you out. Yeah. You see what I'm saying? Yeah. We got to do more documentaries. We need way more dialogue, and we need to normalize, like, look, pain is real. Sickle cell is real. You know, just because I look good, just because I don't look sick, you know, look, I am going through it, you know, and the more conversations and the more transparency and the more communication we have about it, it's going to eventually trickle down to healthcare personnel. Because someone in their family might be a nurse. Oh, I heard about that, man. That shit's awful, man. It's not what they say, man. Them people, they just don't want to get high off opioids. They really be in pain, you know? It'll trickle down to a doctor in the family, or a dentist, or a policymaker that can say, hey, man, that shit's real. Let's put another $20 million in the budget for sickle cell. You see what I'm saying? Yeah. Communication is awesome.
And I've reached out to a few of my classmates. Shout out to the class of 2001, North Atlanta High School. But a few of my classmates have finished nursing school, and one in particular has been in constant contact with me during her nursing school years, and she'll speak up for us. You know, she always asks how I'm doing, check in with me, I check in with her. So I got her on the team, and it was another young lady who just finished, and I reached out to her, and I'm like, listen, if you have any questions, I'm here. I don't mind, inbox me, call me, because I think it starts, like you said, it starts there, trying to educate the people who we depend on.
Absolutely.
Really.
Absolutely.
So that's awesome.
Yeah.
So thank you. Have any more questions, Jennifer?
No, I'm good. I'm just so thankful that you came to bless us with your presence. I'm sorry that I wasn't there to meet you in person this time, but there will always be a next time.
Absolutely.
Thanks for having me, ladies. Keep on leading the charge. You know, you guys are doing great, important work. You know, there's someone out there that might be going through it right now that's going to start speaking up, or maybe try to use cannabis, or maybe wean off some of their Roxys and Percocets or their Xanax. Or maybe they can start talking about a death they had, or a friend, a homie they just lost, and maybe start understanding what that did to them, you know? So, thank you.
Thank you. Let's get into these sponsors before we get out of here. I want to thank Mr. Dan Moore in the Apex Museum. Hopefully he'll be opening up soon and we can get back there, especially for our open mic in September. But you guys just have to see this museum, period. So thank you to the Apex Museum. Thank you to Tanya Robinson at Kids Stop Daycare and Learning Center, who's still making it do what it do with the babies in school, and the Black Professional Network. And thank you, Dr. Hodge, our newest board member.
I'm on that board, too.
I'm holding you accountable.
We're going to do some great shit.
I'm super excited that you have officially joined the team, and I'm ready to work. I'm always ready to work.
Thank you for having me. It's my honor to be asked to be on this esteemed board, so I appreciate it.
Thank you.
Thank you.
All right, let's head out of here. Hold tight. All right, we out of here. See y'all in 2 weeks.
All right, see y'all.